Hi, this is Hi, I'm Dr. Storm Shannon of StormShannon.com. In this video, I was going to go over some common things I see with patients with low back pain. Something you can try yourself if you're suffering from low back pain. See if this helps clear it up. Some concepts with low back pain. Almost always in low back pain, there's very common themes that we see with certain muscles that are weak. Certain muscles that are then compensating for those weak muscles that then lead to the pain. It's a very important concept to understand that you need stretches and strengthening in order to correct your low back pain. So if you go somewhere and they tell you, well, here's a series of stretches to perform and this should eliminate your pain. It may decrease your pain, but you're going to keep having that pain come back until you figure out what is then weak and strengthen that along with stretching and releasing the tight compensating muscles to balance the system back out. So the most common situation that I see involves a few different muscle groups. Primarily we're talking about the hip flexors or the psoas muscle, which most people think of the hip flexors, they think of muscles down in here that bring the hips up. That is part of their function, but there's also an upper portion of the hip flexor known as the psoas that runs up and attaches into the entire lumbar spine. Actually has some attachments into the diaphragm as well. So it can definitely cause problems in your low back, whether it's weak or strong and compensating for something else. So we'll talk about that. The other most common muscle that we see that has problems is the QL, which is the quadratus lumborum. Runs from the lower rib cage down to the pelvis and attaches into the lumbar spine as well. Also, can play a role with the diaphragm. So it's another major common issue that we see, whether it's weak or compensating. Finally, the one everyone's familiar with is the abdominal muscles. Most people have heard, hey, if your low back hurts, it's because your core is weak. Well, most people associate core with abs, and that's not really the case. The core is all the way around. We already talked about two muscles, the psoas and the QL. They are part of your core as well. But most people think core, they think abs, and more specifically, they think the superficial six-pack rectus abdominis, which can be weak. Primarily the lower part of the rectus abdominis we will find is weak, isn't working properly. And its job for low back is it tends to flatten the low back. So if it's weak, a lot of times we see those people are in a hyperextended posture when they're walking and sitting, and it puts a lot of pressure on the low back. So we do see weaknesses there. We also see weaknesses in a muscle most people have never heard of, called the transverse abdominis, which sits deep to the rectus and actually acts like a girdle, wraps around and helps to stabilize, for the entire core when you're moving around. Those are the most common ones we see issues with. And most commonly what I find, almost, the 80-20 rule, 80% of the time I find a weakness in the QL or in the psoas. And one is compensating for the other, or we find that the upper back is compensating for weakness through the QL or the abdominals or both. So that's what we're going to kind of cover in this video. Is I'm going to show you how to release the most common compensators, being the rhomboids, the QLs, and the psoas. And then I'm going to show you some strengthening exercises for the rectus abdominis, the transverse abdominis, the QL, and the psoas. That way you can play around with, and even if you don't know which one is weak and which one is strong, you can start playing around with loosening up some of these areas. I'm going to show you a certain sequence based on the most common compensators to the least common compensators, so that as you go through to stretch and release, you should see benefit with all of that. The only equipment that I'm going to be using in this video is a foam roller and a lacrosse ball. So less than 20 bucks worth of stuff that you can buy pretty much anywhere. Lacrosse balls are kind of hard to find, but you can find a hard ball of some sort if you're having problems finding a lacrosse ball, or even a massage ball works. to start down that path. But let's jump into this. So we're going to start with the most common compensator that I see, because most people have multiple weaknesses through their core, and when that happens, what we see is the upper back will start to compensate. Sometimes we even see the neck, but in this video we're mainly going to stick with the upper back, the shoulders. So we're going to work on the shoulder blade area, a muscle known as the rhomboids, and we're also going to tie in a little bit of the lat and the muscle that's deep there, the subscapularis. There's the word. All right, so we're going to tie in some releases for those 3 muscle groups, just to kind of get a general loosening of the upper back and shoulders. And we're going to do all of those using the foam roller and the ball here. So we're going to start with the foam roller to get the lat and that subscap, and then I'll show you the ball for the rhomboids. So real simple. For this, you want to make sure, I'll try to get an angle so you can see it a little bit better, but I'm going to lay at kind of a 45-degree angle. I'm not going to lay directly on top of this, and I'm not going to lay flat on my back on it just yet. So for this, to release the lat and hit that subscap a little bit, it doesn't get it a lot, but it does help, is lay at a 45-degree angle. I'm going to put my weight on this, get it right into that armpit, and then I'm just going to use my body weight and roll back and forth. If I find certain spots, if you find like a really good tender spot, just kind of hold pressure into that spot. It may take even up to 2 minutes or so for it to finally feel like it's starting to let go, and then you can start rolling again, try to loosen it up even more. And then you'll just switch and do the same thing on the other side. For the rhomboids, you can use the foam roller, and you can roll this way to hit that upper back. This feels pretty good on the spine, especially in the upper back, and a lot of times you'll even get some popping and cracking as the spine loosens up. You can even do some reverse crunches to loosen that more. But if we want to make sure we're specifically hitting that rhomboid, that's where the ball comes in. And so what I'm going to do is I'm going to take that ball and basically get between my shoulder blade, the edge of my shoulder blade, and my spine. I want to get right in that groove is where that muscle sits, because it runs from one to the other. Get on my back, find that groove, same thing. I'm going to search for any good tender spots, hold pressure into those first until they start to release, and then I'll kind of roll around and loosen up the rest of the area. So same thing, you probably spend a good 2, 3, 5 minutes, or more in this area, depending on just how tight and how tender you are. And just really try to work on it and free it up the best that you can. So once again, once you're done with one side, just switch and do the other side as well. Okay, so there's those two. Now we're going to work our way down. The next most common compensator is that psoas. So we want to work on releasing it. You can compress it and release it, and I'll show you that real quick. It's a little bit awkward, so if you have any troubles, I'll also show you how to stretch it out. To compress it, laying on your back, knee bent up. If I'm doing my right side, I'm going to find the bony knot, the front of the pelvis. So once I find that, I'm going to draw basically a line from there to my belly button. And that line is kind of the line that you can follow to find the psoas, and you just want to put pressure down in there. Now I can use my hand, I can use a water bottle, I can use a dumbbell, I can use a kettlebell, and I can put a little bit of pressure in there, find where it feels like it's a little bit tight. A lot of times it'll be tender, and just hold some pressure into it until it feels like it loosens up. So if you're having trouble though finding it, because it isn't the easiest thing to find yourself, then we can also stretch this muscle. Alright, so to stretch it, if I'm stretching my right side, the right knee is going to be down. Left knee is going to be up. Now watch, I'm going to keep this in a straight line. I'm not bending back, I'm not bending forward. I'm keeping this right here, and I'm just pushing my hips here. So now this is still in a straight line, but my hip has opened up. So I'm starting to get a stretch right in here. Once I start to get a stretch here, I'm going to raise my right hand, same side I'm stretching, and lean to the left. That's what's going to make it pull into that upper portion of that psoas portion of that hip flexor. Then I'm just going to hold that for 10 to 15 seconds, relax, and I can repeat it. Or I can just do a sustained hold for a minute, 2 minutes, and stretch it that way. You definitely check both sides with that one as well. That one's really common. That one side will be really tight and the other won't. And you'll notice a definite difference in those. So, once those are all released, now we'll move to the QL, which is the least common of the compensators, because most of the time I find that it's weak, and everything else is compensating for it. But in this case, sometimes you will find that it is tight, and a lot of times when you find that it is tight and compensating, it's compensating for weakness in those hip flexors. So that's why we're going to show an exercise for the hip flexors as well at the end. But for the release, we're going to get the ball back out. This time, to find the QL, what you're going to do is you're going to find your lower rib cage, right at the bottom of the ribs, and you're going to follow it to the spine. Right at that corner of the rib cage and the spine is the most common area where you'll find a trigger point in that QL. So we put the ball in there, lay on my back, kind of search around, find for where it feels a little bit tight, then I'm going to pull my knee to my chest. If it's really tight and sore, this may be as far as you can go to start with, is just bending the knee up. Make sure when you're doing it, you're also relaxing your head. I'm obviously lifting just so I can talk to you. So, but to start with, this may be all you can do. Just hang out here till it loosens up enough to where you can grab your knee. Hold that for a while, then work your way. Get it to the point where you can really put some pressure in and release that muscle. Okay? With all of these releases, all of the stretches also, make sure you're breathing. We talked about how the QL and the psoas especially have connections into the diaphragm. So if you're taking nice, slow, deep breaths, it helps it relax even faster because of those connections. So make sure you're breathing, you're not holding your breath. Especially if the muscle's real tender and you hold your breath, you're just tightening up, you're not allowing that muscle to relax. So it's going to take even longer. Alright, so let's move on now to the strengthening side. So we got done with the releases. We talked about the common compensators. Now we're going to talk about the most common weakness and then work from the most common weakness to the least common weakness. So the most common weakness in this case is that QL. It's the one that I find most of the time that is causing low back pain. Now, a lot of times the abs are weak too, but in the case of pain, the QL being weak will cause the QL to spasm. And a trigger point in the QL, we know through research, is the reason for about 80% of low back pain. So that's why we're going to start with actually working on strengthening it as opposed to starting with strengthening the abdominals. So how do we do that? Through everybody's least favorite exercise probably, the side plank. So when we do this, we've got to make sure of a couple of things though. We want to make sure that we're in a straight line. Now, foot position. You can go stacked. In the beginning, I would suggest actually staggering one foot in front of the other. Make it a little bit easier on yourself. So we're just working on activating that muscle. Next, before I lift, I want to do a crunch. I want to do a little bit of a crunch, activate those abs, flatten that low back, just a little low back pain. So we're just getting ready to do the side plank. So, again, where we started, you want to be in a straight line through here. Feet can be staggered to start with. Do a little bit of a crunch here, tighten up those abs, flatten that low back just a little bit. Make sure you can still breathe. I'm still able to talk to you. I'm not holding my breath. I'm just engaging my abs. From there, I'm going to bridge up and I'm going to hold. I'm just going to do about a 10-second hold. If you're real weak in the beginning, start with even a 5-second hold and relax. And start with a 5 reps of 5 seconds. Then build up to 5 sets of 10 seconds. Then go to 10 sets of 10 seconds. Once you can do 10 sets of 10 seconds, Then you can really start jumping forward to like 30-second holds, 60-second holds, doing all of that. But in the beginning, it's very important to do short holds, more reps, because that muscle isn't firing very well. So if you try to engage it when it doesn't want to fire because it's weak, it's just going to turn off and let your compensators take over. That's why we fire it for a short period of time, shut it off, let it relax a second, fire it again, let it relax, fire it again. We're teaching it to fire stronger and stronger and stronger. So, like I said, start like a 5-second hold, 5 reps, both sides. Then build to 5 by 10, then 10 by 10. Alright, next exercise. Now we're going to go for those abs, those lower abs, those deep abs. We're going to do that really simple again. We're going to start with just doing a plank. And then we're going to show a little bit of a modification of that plank to engage the lower abs even more for you. So, keys with the plank here. You can do them on your forearms or on your hands. Either one is fine. I'm going to do them on my hands for this one. Now, just like the side plank, I want to do a little bit of a crunch, tighten up my abs, then come up. I want to squeeze my glutes, and I want to push my shoulders forward. I don't want to be hanging here and putting all that weight in my joints. And from that's the position I'm going to hold for my planks. Same thing, start with a 5-second hold, relax, 5 repetitions. Then go to 5 by 10, then 10 by 10. Now, once you can do 10 by 10, you can make it a little bit more challenging, doing a couple of different things. You can either do plank bridges, going back and forth for repetition, coming up and coming back to that start position, or you can bring knees up to engage those lower. So we did the side planks, we did the planks. Now the last exercise we're going to talk about today is doing a hip flexor straight leg raise. This is for that weak psoas if it's there. So real simple, we're just going to put it in a position where it's going to engage the best, and we're going to do a lot of repetitions. So laying on my back, I'll even come at the screen a little bit, make it so it's a little more obvious. What I'm going to do is I'm going to take my leg out to the side. We'll do it with this one. It's a little bit. Let's find the right angle here. Coming right at you. So I bring it out to the side about 45 degrees, rotate my foot 45 degrees, and then I'm doing a straight leg raise. Now everything is flat on the ground. I'm just lifting my leg up and back down. Just like that. Big thing with this. When you're doing the raise, make sure your back stays flat on the ground. Head should be relaxed, arms at the side, and I'm raising up and back down. Same things with the planks and the side planks. Do that crunch, flatten your back, raise, hold for 5 seconds, relax, 5 repetitions to start with, build up to a 5 by 10, then a 10 by 10. So once you've gotten to the point where all of those are pretty easy, then you can go to more advanced stuff. You can go, the leg lifts, scissor kicks, all of those, fancier, exercises that are going to engage some of those muscles for you. You can do side planks with the twist. You can do, side planks touching the hip and coming back up. There's multiple variations of different exercises you can do, once you get to that point. This is the starting point, though, to get your muscles firing correctly to start working that way. Now, again, we're going off of the 80-20 rule. This is the 80% most common dysfunctions I see that lead to the low back pain. So, start with these, see if they work for you. Hopefully they will help you, and they'll help, manage your discomfort and start seeing some improvement. If you do them, and you're doing them consistently, whereas I usually tell my patients at least a couple times a day you want to do these exercises because you're retraining your brain to start using these core stabilizers instead of these other muscles to compensate. So, at least a couple times a day, run through these exercises. Do that for at least 2 weeks. If you're still not seeing improvement, it's likely that, unfortunately, you fall into that other 20% where your compensation pattern is a little bit different, and you probably need to go see someone like myself, who specializes in some kind of muscle testing technique. The particular one I use is called Neurokinetic Therapies. You can go online to the Neurokinetic Therapy website, and you can search for a provider to find someone near you. But you want someone who's going to test those muscles so you know exactly which one is the weak one, and you know which one is compensating. So you know exactly which specific stretches and releases to perform, and which strengthening exercises you need to do. Okay? So that's it for these series of videos. Try them out, check it out, see how it works. Let me know how it works. I'm interested in seeing how much it helps everybody out there. All right, well, that's it for me. We'll talk to you later. Bye.